For plan sponsors who have reached this part of the website, you probably know now that there are new requirements under the Consolidated Appropriations Act that require reporting regarding prescription drug cost and healthcare cost. I'm going to cover that very quickly in this video as a quick rundown of what you need to understand from a plan sponsor perspective. You'll also notice that there is a Learn More button. It's either above this or to the left of this, depending upon if you're visiting this video from a mobile device or from our website. If you have reached this page because you have the need for someone to help you through some drug cost reporting, after you watch this video, I would recommend that you go that direction, because this is just going to tell you a little bit about what this is, not how we partner with plan sponsors, but we certainly do that. So in December of 2020, the Consolidated Appropriations Act, or CAA, of 2021 was passed. And a portion of this bill did a lot of things to plan sponsors. Of course, self-insured and plan sponsors, you're experiencing a lot of it, from surprise billing to shoppable services and machine-readable files. And there was another piece to this reporting, to the overall bill, that's created a tremendous amount of confusion in the marketplace. And it's candidly put the marketplace well behind where we probably certainly should be in getting this done. But the long and the short of the reporting is that the stated purpose is all about gathering certain information regarding the spend of healthcare plans, prescription drugs specifically, as well as healthcare spending, so that they can understand where plan assets are being spent. Also, too, from our experience in working with this, anytime you see an article that refers to the medical debt of the population in general, you can kind of track your way back to this reporting, because the reporting is really digging into different elements of your self-insured plan and how that might be causing people to have medical debt. That would come in the ways of employee contributions, as well as coverage or costs that weren't covered by the healthcare plan, copays, deductible, coinsurance, what have you. They're also wanting to gather information on the prescription drugs in terms of what amount of monies are there that look like they're coming out as a claim, but they're rebates and there are other monies that are being pulled out of the system by the pharmacy benefit managers. In some cases, they're wanting to be able to put a number on that and understand and begin to measure what those numbers are. And all of that requires some reporting. For the very first year of reporting, the requirement is to do 2020 and 2021 calendar years, and that is due by December 27th of 2022. Then ongoing each year, what you're going to find is that June 1st is the reporting date for the prior calendar year. So for the very first regular year, if you'd like to look at it that way, June 1st would be the reporting date for the 2022 calendar year. Ultimately, this reporting requires coordination between TPAs and pharmacy benefit managers and you as a plan sponsor, and therein lies a lot of the tricky nature, especially if you find situations to where you might have changed vendors, changed TPAs, or changed PBMs during any of these periods of time between in a calendar year. If it were during the 2020, 2021, or really any calendar year moving forward starting at 2020, all of those entities have to be involved in this reporting. And this applies to fully insured cases as well as fully insured groups as well as self-insured groups. But on the fully insured, the carriers are really taking responsibility to do that reporting. However, to the extent that you are self-funded or level funded, or even maybe in some cases, minimum premium plans, in very rare cases, most of the time our clients are going to be self-insured or level funded, you have a requirement to complete your reporting. Now, whenever you have a reporting deadline, it's a little different than other reporting or other compliance requirements, because it's time stamped when it ends up hitting the system. So there's a very easy track record as to whether or not we hit that date in time or if we missed it. This is a quick look at the different data files and where these elements are coming from. If you look here in the center, these data files, in this aqua color, there are 6 different data files that have data elements that will be coming from the pharmacy benefit manager. They're the only ones who have this data. Your broker does not have this data. They're the only ones that have it. Similarly, when you look at these green, that is what the elements that the TPA has. And so you can even imagine if you were with two different PBMs during a calendar year, you have two different sets of these data. And to further make things challenging, in order to complete some of this D2 data elements here, we need other elements. We need to know, for instance, what the prescription drug spending was, as well as rebates and some other items in this file. So it's not so much that the calculations are so intense or so complicated. It's just a lot of data and it's just a lot of coordination, which makes it incredibly difficult to pull off. For that reason, it is very often the case that these pharmacy benefit managers or even the TPA will simply deliver data files to the plan sponsor and say it's your responsibility to do the reporting. Ultimately, it's on the plan sponsor to be able to make sure that the reporting occurs and that it happens timely and that it happens accurately. And so to the extent that that falls back on you, the main thing to understand at this point is that we do have a solution to be able to help you. That is the Learn More that I mentioned previously. You can take a look at that and you can look through the entire process of how we go about doing that. So what should you be doing at this point? The number one thing you can do is figure out what your TPAs and PBMs are doing. And are they going to be reporting on your behalf or not? How are they going to be handling like a terminated group, meaning if you terminated with them and you're no longer with that TPA or that PBM? What if there are multiple vendors involved? And some of these folks are just going to provide the files directly to you as a plan sponsor. These are questions that you want to figure out. And truthfully, until you have those answers to those questions, there's nothing that we can do as an organization. Very commonly, we'll get lots of calls. And again, the marketplace is very akin right now for people that might remember ACA reporting in 2015. This company right here, ACA Reporting Service, was the first company we launched, and people know it as some different brands in the marketplace. This is very similar because if you lived through that, you probably remember how people didn't really understand, and then there was a huge, massive flood of people trying to figure out what's going on with ACA reporting. This is the same thing, but arguably worse for drug cost reporting under this new requirement. So to that end, we haven't had a choice but to streamline a lot of the things that we do. We'd love to be able to answer every telephone call and set up a 45-minute call and talk to people in depth about these different elements. But instead, what we've had to do out of necessity is record some items that give you exactly what the same answers that you're going to be able to get if we did have the time to spend a half an hour with you on the call and to go through some things. So from here, I would recommend two things. Number one, if you want to learn how we help plan sponsors, you would definitely want to click on the Learn More, and that will walk you through the process of every single thing that we do, all the way to signing a contract, getting an invoice, and getting started if that's what you desire. If you want to take a step back and you're more interested from a different perspective, meaning just like holistically, what I would do in that case is click on this Q&A from our main website, drugcostreporting.com, and that will give you some more information as well. So reach out to us if we can be helpful. But again, clicking on this Learn More is going to be the best next step for you to get the best information you can. We also have the answers to your questions most frequently addressed, and we're constantly adding to this as well. So we hope you find this helpful.